And I think that's a really important thing because a lot of people will say, oh, go get a bachelor's degree and not realize all the things that go into that decision. Because, first of all, bachelor's degree, especially right now with Project 2025 and all the things going on, that might not be realistic for some people to come to go get $100,000 plus in a student loan. So, do you feel like it was competitive to get into your associate's degree program?
I do
So, do you feel like it was more competitive to get into an associate's degree versus a bachelor's degree program? So, why did you go back for your bachelor's? Do you feel like your options were limited because you have an associate's degree versus a bachelor's degree for like remote or like other opportunities like outside of bedside?
those leadership or remote that everyone's talking about. Absolutely. So I went ahead since I'm graduating Monday. I put in on my resume. I redid it and I put my BSN on there already.
Yeah.
I've already secured a remote
Because
job.
a lot of people think, again, huge miss, that people who are associate degree nurses are not as prepared to take care of patients clinically, or that they maybe even have a different NCLEX. I don't
Which
know
is
if you're able to see like what the pay difference would be if you had a bachelor's degree in your current role. Is it the same or is it
Should you
different?
get an associate's degree in nursing or a bachelor's degree in nursing?
So today on the podcast, we're going to be talking about which nursing degree pathway is right for you, the pros and cons, and which is better. So y'all, welcome to the West T podcast. I'm your host, Morgan, aka Morgan San Diego. And today with me, I have Alicia, who is an associate degree nurse, and we're going to get into it and spill the tea, okay? Alicia, tell us what's your background, how you decided to become an associate degree nurse, and, just kind of give us the game about like if you feel like you would go back and do anything differently, or would you still choose this path?
okay. So I've been a nurse for a total of about 12 years. I would like to say that I took the scenic route. Sure, I started as a LPN. I got my ADN, and I wrap up my bachelor's on Monday. So I would say I wouldn't change anything about my route. ADN is definitely worth it. It helps you get your feet wet. It helps you connect with people. And it really just depends on your end goal. If you have your heart set on like leadership or graduate school, I would definitely say BSN is essential for that. But otherwise, ADN allows you to work, continue education, and juggle everything while still, getting money.
And I think that's a really important thing because a lot of people will say, oh, go get a bachelor's degree and not realize all the things that go into that decision. Because, first of all, bachelor's degree, especially right now with Project 2025 and all the things going on, that might not be realistic for some people to come to go get $100,000 plus in a student loan. So, I think that associate degree programs, especially for people who are working, people who are already in a career, it gives them the opportunity to be able to still come in into the nursing field, possibly get someone to pay for their degree if they want to go back to school, but also to be able to have an entry that isn't going to take 4 or 5 years.
Correct.
Yeah. So do you feel like it was competitive to get into your associate's degree program?
I do feel they were competitive.
Okay, okay.
Yes.
So do you feel like it was more competitive to get into an associate's degree versus a bachelor's degree program?
The bachelor's, not so much because I'm bridging over.
Right, right. Okay. So I feel like the associate's programs, especially like I'm from Maryland. So our associate degree programs are so competitive because CCBC, for example, and BCCC are some of the best nursing programs in the state and their community colleges. But it's so competitive because everybody is looking at the price tag and they're also looking at, well, I had this demand and I had that demand. And then also, to be honest, associate programs usually have a lot more flexible for their clinical hours. So you might have a clinical that might be 12 to 8 or a weekend only clinical or a lot more weekend only clinicals in that setting.
Right.
So it's a lot more beneficial to people who have families and kids and have to work and can't find, a lot of resources or have a lot of familiar support to do it.
And that plays a big factor, your support, your finances. I'm happy to say I've never taken out a student loan in this process. I had tuition reimbursement for going back for my BSN.
Wow.
The ADN, the BSN was completely online. There was like a one-off clinical,
Hmm.
which was doable. So I was able to juggle everything and still no student loans, no debt at all.
Wow. So you were able to get your employer to pay for it.
Correct.
Great. Okay. So do you think that it's that it's really realistic to have people who had their employers pay for their bachelor's degrees? Like, do you feel like that's a really common experience?
I do, because they're
Yeah,
really pushing it. They're
yeah,
pushing it. So
yeah. So why did you go back for your bachelor's?
because bedside is getting old. Priorities have shifted.
Mhm.
Initially, I was like, work my 312s, 4 days off. Oh, that's fine. I can do that. But over time, I'm like, okay, I'm tired. In your 30s, everything is different.
Yeah.
I'm prioritizing family time and travel. Uh,
Yes.
and I work night shift to say that. So I'm exhausting the most amount of money I can get. So night shift weekend contract, the money is there, but it's mentally taxing.
Do you feel like your options were limited because you have an associate's degree versus a bachelor's degree for like remote or like other opportunities like outside of bedside?
Yes. Bedside, no limitations, but those other roles, leadership or remote that everyone's talking about, absolutely.
Mm.
So I went ahead since I'm graduating Monday, I put in on my resume, I redid it and I put my BSN on there already. I've
Yeah.
already secured a remote job. So I do feel like that absolutely helps.
Okay, so let's pause. She just said that the second that she put her bachelor's degree in nursing on her resume, that she was able to go get a remote job just because of that difference.
Right. I've been applying for about 2 years now, consistent, 5 apps a day.
Wa-
When I changed it over after my last final, job secured.
Wow.
Graduate Monday, start next week. So
Period.
absolutely.
So do you feel like the investment was worth it for your time?
Absolutely.
Because you didn't have to spend your actual money. So
Yes.
the time investment and going back was worth it.
Absolutely.
And you would do it again.
I would do it again.
Okay. So let's talk about the clinical preparedness because a lot of people think, again, huge miss, that people who are associate degree nurses are not as prepared to take care of patients clinically, or that they maybe even have a different NCLEX, which is not true because we all sit for the NCLEX RN. We're, associate degree nurses and bachelor's degree nurses. We all sit for the NCLEX RN. It doesn't matter. But I feel like, honestly, a lot of the associate degree nurses were more prepared.
I felt ADN, yes, absolutely prepared on both ends, NCLEX and clinical. I feel that since it's such a short program, did they really push that practical knowledge and you got that hands on?
Yeah.
I was prepared for NCLEX
Yeah.
for sure.
Yeah. Do you feel like compared to some of the bachelor's degree nurses that you work with, did you feel like more or less like, girl, where you go to nursing school? Like,
Feel more prepared, yeah.
yeah. Wow.
Real
But I
world
felt
knowledge,
that too.
real world knowledge, that experience for sure.
Yeah, I felt that too. I don't know if you're able to see like what the pay difference would be if you had a bachelor's degree in your current role. Is it the same or is it different?
So currently I'm bedside at a local hospital. There's no difference. There's no difference.
So y'all heard that right.
Unless you're in leadership, unless you're a nurse manager, you're an educator, it may vary, but it's minimal.
So
For sure.
everybody's pay is the exact same, whether or not they're an associate degree or a bachelor degree nurse at her hospital. So no pay difference at all. That's kind of crazy.
It's minimal and it could vary by location. I'm from Alabama, but it currently no.
Okay. So when you were going through and picking like what program you were going to do for your ADN to BSN, which is basically like a bridge program that she was talking about. So that's how you can get a bachelor's degree in nursing if you already have an associate degree in nursing. What did you look for in programs that you were choosing? And do you feel like it's okay to go to an online school? Do you feel like you had less opportunities, or do you feel like there was any like type of limitation?
I looked at the cost and the flexibility, um, which a local school, UAH, that I had, they did both. It was completely online. And I just feel that there was just a much more core curriculum that focuses on like research and leadership that helped that.
Mm,
The cost, my job covered that, so that wasn't a thing. But it being online allowed me to juggle school and life. So
yeah.
and still complete the program.
Yeah, I like that. So we already decided that pay is definitely the same, but you feel like having a bachelor's degree gets you more opportunities.
Absolutely. Especially in a remote world, which is everybody's trying to get away from bedside. It's draining. The money's there, the overtime's there, but it's
Mhm.
draining. They're increasing our workloads. We're working short staff. So yes, absolutely.
Yeah. So what are the ratios been where you've been?
I work night shift and at night we get About 5 patients
And this is in
on a good
med-surg?
day. Yes,
Okay.
med-surg.
Okay. So, do you feel like having an associate's degree limited you from going into a specialty? And have you worked in a specialty before?
I haven't been in a specialty. I did briefly work hospice to get that case manager by my name to kinda
Mhm.
help with my resume, but that's about it.
Okay. Okay. So, if you were gonna give advice to future nurses who wanted to possibly get an associate's degree, what would you tell them as far as, like, what to look for, in programs, or how would they know whether to be a ADN or BSN? Like, what advice would you give?
So like I said, it depends on your end goal. If you're not sure, I'll definitely suggest ADN to get your feet wet and explore everything. Um, Make sure the school is accredited, but,
That's
wow,
Lord.
make
Especially if it's in Florida.
yeah. So accredited costs and I guess the flexibility and consider your finances and your support as well.
Yeah. I think it's so key that you said something about the professional roles because, if you want to just get into nursing and just stay in, like, if you know you want to be a labor and delivery nurse and that's all you want to do, then it's totally fine to have an associate's degree. But when you start looking at different, pathways like CRNA or even being a nurse practitioner, because yes, there are some associate degree to in masters in science and NP roles. There's a lot more difficulty when you're looking at roles like CRNA and stuff, so
Mhm.
you really have to be strategic about what works for you.
And now that you say strategic, I would say be flexible and open to, it might be a job that you really don't care for,
Yeah.
but use it as a stepping stone. The hospice definitely helped on my resume to get me where I am. The remote case managers.
I think there's nothing wrong with hospice. Hospice is kind of fun.
That's cool.
Yeah, I feel like
But all
hospice
that
is
ripping
great.
and running, I don't know, that weird on me. But the nature of the
Yeah.
job, I liked it.
Yeah.
But
Okay.
definitely a stepping stone.
You know that with a lot of our current changes to our political climate, with Project 2025, it's going to change accessibility for nursing students. And, I have a bachelor's degree, and it was very affordable for me to get a bachelor's degree because there was a lot of funding at my institution kind of for that role. But when you look at, these people who are going to be coming into nursing who are possibly not going to have $100,000 just laying around or will have to get, private loans to secure their schooling, it's just not very realistic.
Right.
And I think it's gonna make associate degree programs even harder to get into. It's gonna make it even more competitive because I mean it was competitive when I went to school, but this is a whole new world.
Yeah.
Yeah.
They're kicking it up.
Yeah. So I think associate degree programs are really gonna be very much more competitive and it's gonna be some waiting list to get in.
Yep. I
Yeah.
agree wholeheartedly.
Yeah. So any advice before we close out to people who might be interested in doing an associate degree program or might be wondering if that's the role for them or even, just like kind of just general advice.
Like I said, it's a great start, especially if you don't want to commit just yet. You're unsure of where you want to be. Um, Affordable, get in while you can, like she said before 2025 project.
Mhm.
Um, and also network with people because sometimes it's who you know and not what you know.
Very true. Very true. Well, thank you so much for
Thank
coming on the
you.
podcast, Alicia. Thank you. Well, guys, if you want to connect with Alicia, make sure you do. You can follow her on Instagram. You want to tell them your Instagram handle?
Sure, it's the Leash K, TheLeshK.
Awesome. And you can always comment questions underneath and make sure you subscribe because it's more tea to come around. All right, y'all. Bye.
Bye.